The HARC Scholars Program is principally designed to enable people working in agencies that are involved in clinical improvement or clinical change to travel overseas usually and to do some study around a particular topic in which they're interested. And the HARC collaboration consists of the Sachs Institute, the Agency for Clinical Innovation, the Clinical Excellence Commission and the Bureau of Health Information.
Well, the HARC Scholars Program has been established to give the member organisations an opportunity to sponsor projects undertaken by staff, which will give them an opportunity to develop their own knowledge, but bring back to the organisations some information or some connections internationally that enable us to progress each of the organisations' work.
My role is managing the statewide burn injury service, and I wanted to look at our gaps in services in New South Wales, which is really our post-acute care, and I wanted to look at some other models where they may be doing it better. Interesting things that were quite different. Camouflage makeup for burn survivors post-burn is really standard care in the UK, so all their occupational therapists are trained in camouflage makeup skills and then teach their survivors, whereas in Australia we don't really do it.
It gave me the chance as an early career researcher to meet the leaders in the field, so the people whose publications we follow and observe and their work. Really so I could get a better sense of what their priorities were and how my research might sit alongside that.
I had an idea about the use of social media to fast-track evidence into practice, so the HARC Scholarship was a fantastic opportunity for me to explore that properly. The program allowed me to bring very new, very contemporary information into the CEC, and I was able to learn from centres of excellence around the world through my study tour. So for professionally, it was a game changer.
Well, I think it's a really important opportunity. This program enables us to invest in our people. It's a way that we can develop them, give them an opportunity that they would not otherwise be exposed to gain knowledge, experience, to make those connections, bring back those learnings and develop up the work inside our system and support better improvements for patients across the whole of New South Wales.
The program's helped me advance in my field by establishing new links with researchers elsewhere, and I learnt a lot about various different implementation frameworks and strategies, a lot about the theory that underpins behaviour change, and then really concrete examples of how you actually go about bringing about change in practice.
So in August last year we were very excited to appoint a human factors specialist to the Clinical Excellence Commission, and that's the first time a human factors specialist has been employed in an Australian healthcare service that we're aware of. So without the HARC experience and getting that knowledge and getting the practical information about where to start that process, we wouldn't have Thomas working with us today.
It's easy for people theoretically to say, well, this is how the system should work and this is how you can improve it. But sitting in an armchair maybe in a university or something like that. But these are people who've actually got to do something to make a change on the ground, so that's why it's important. It's real people with real jobs actually drawing the evidence they need to come back and present something that will lead to some improvement. And nearly every one of them has come up with 3 or 4 things that have actually been implemented since they've done their work.